Now, continuing with the medical legal examination of a case of an alcoholic. Now, this lecture is most important as far as the students are concerned, as well are the practicing medical examiners, the medical legal officers, and the demonstrator medical legals, to whom the police brings in an individual for the assessment whether the person is under the influence, whether the person is drunk, stuporous, and it is due to alcohol intake. So, a medical practitioner is frequently asked by the law enforcing authorities to examine a person for causing nuisance in public places or driving a vehicle under influence of alcohol or had committed an offense under its influence. Under such circumstances, a doctor is expected to examine the person and opine regarding the following points. Number one, whether the examined person has actually consumed alcohol, or there's a lot of differential diagnosis. He could be suffering from a cerebrovascular accident. He could be hypoglycemic, hyperglycemic, hypertension. He could be bit by a alapid snake. And there are 101 differential diagnoses that are to be differentiated from the alcohol consumption. Number two, if he had consumed alcohol, whether he is under its influence or it has passed away. Then, thirdly, the registered medical practitioner should know what is drunkenness, and then how to examine such a person, and finally, how to collect exhibits which might be used for evidence in the court of law. As far as the definition of drunkenness is concerned, drunkenness is a condition produced in a person who has taken alcohol in a quantity sufficient to cause him to lose control of his faculties to such an extent that he is unable to execute occupation in which he is engaged at the material time, like driving or like working or like performing any act, like operating any machinery or any sort of the work that he is busy in at that time. Now, for the medical legal examination, we always teach our students and our doctors that consent is of prime importance. Section 90 of Pakistan Penal Code says that any examination which is conducted without consent, or a consent that has been obtained by fraud, by coercion, by threat, by any sort of efforts that are not legally abiding, all that consent is invalid in the core of the law. But there are certain conditions in which the consent is not applicable, where it is not a practical applicability to go ahead for taking a consent from the individual. And these three medical legal scenarios include: number one, intoxication under any substance that, like alcohol or Jimson weed or any inebriant or any sedative or any other drug, whether it's a street drug or a pharmaceutical preparation like benzodiazepines or anything like that. Because in that state, the person is not in the fully state, in the full state of his mental capabilities to give a consent. Secondly, is obviously insanity. An insane person can't consent for himself or herself. And then finally, the age of immaturity, that is the legal age, that is 18 years of age in Pakistan. So anybody under the age of 18 years cannot consent for his or her examination. So, and besides that, however, if a person has been arrested for a criminal offense and is under the custody of police, then as per CRPC section 53 subsection 1, the medical practitioner can proceed with the examination of the accused without his consent. Because one thing is that he is already under the intoxicant effect of alcohol, and secondly, he has been arrested for a criminal offense, like he has been a public nuisance and he has been creating some disturbance in the law and order situation, and he has been arrested by the police. And in that condition, a person who is under the influence of any drug or alcohol can be examined without consent. Starting with the examination, to begin with, we have to note down all the biodata, like the name of the individual, Age, address, gender, identification marks, time and date of medical examination, name of the accompanying person, and the brief history should be recorded. Starting with the physical examination, we have to look for the general appearance of the individual. We have to look for his clothes, whether they are soiled by vomitus or fetus, his behavior, his disposition, his orientation to time and place. Secondly, we have to record the vital data such as the temperature, pulse, blood pressure, respiratory rate, and the pupils are to be assessed. In alcohol intoxication, there is tachycardia and vasodilatation of the cutaneous vessels that result in warm and flushed skin. Respiratory rate may be increased, and low doses of alcohol cause a mild drop in blood pressure, but more consumption results in a dose-dependent increase in blood pressure. Next, we have to note the speech of the individual. It might be normal, it might be thick, slurred, or over-precise. Speech production is a complex motor activity and requires coordination and is considered as a sensitive index of alcohol intoxication. Especially, slight distortion of certain consonants is one of the early signs of incoordination of muscles of tongue and lips. Next is the breath. A smell of alcohol is present or it might be absent. The congeners that are added in the alcoholic beverages impart peculiar odor to that which could be appreciated in the breath of a drunken person, and it's kind of a fruity smell. Next is the stance. Does the individual stand properly, or is he swaying either way when standing erect with his feet together and eyes closed? A drunken person always sways while doing such an exercise, and this is known as a positive Romberg sign. In the Romberg's test, the person is asked to stand with his feet closely approximated, with his eyes open and then with his eyes closed. Next important point to be noted is the gait. When the person just walks into your ER, you just have to observe whether the gait is normal or staggering. A drunken person has a staggering gait. The person is asked to walk on a straight line. His gait should be observed. While walking a straight line, the person is asked suddenly to turn to judge the reaction time. The drunken person will take more time for turning and takes 1 or 2 steps before turning. Next comes writing. If your individual is brought in police custody, if he is a literate person and can write, the person should be asked to write a few lines in a language familiar to him. Note the time taken to write and repetition or omission of words, ability to read his own handwriting. The drunken person often takes more time to copy a sentence and may have difficulty in writing the letters N, M, or W. Often he omits or repeats some words or alphabets. Next, eyes are to be examined. Note the state of conjunctiva, pupillary size and reflex, visual acuity, and presence and absence of nystagmus. In a drunken person, conjunctiva are congested. The pupils in early stages, it is stated that the pupils are dilated. And as the level of intoxication advances, especially in coma, they become pinpoint. Pupillary reflex is a response to light which is either delayed or sluggish in a drunken person. Then reflexes, generally in the person who is under the influence of the drug, the knee and the ankle reflexes are sluggish or delayed. Plantar reflexes may be extensor or flexor. Then muscle coordination. Following are the some tests that are used to determine the muscle coordination. Number 1, the finger nose test. Here the person is asked to touch his nose by his index finger alternately with each upper limb. Then finger to finger test, unbuttoning and buttoning of the shirt, picking up objects from the floor. And finally the memory test, the ability for the recent memory. At times there is anterograde amnesia.